All right, bed rest complications. Bed rest and a lack of exercise and activity can cause the following serious complications. It can cause pressure injuries, constipation, and fecal impaction, which can lead to weight loss, urinary tract infections or kidney stones, blood clots, also known as thrombi, which can cause stroke problems. It can cause heart problems and lung problems, pneumonia, inflammation and infection of the lung. Okay. Musculoskeletal system complications like contractures, muscle atrophy, osteoporosis, or orthostatic hypotension, also known as posterior hypotension. Those are a lot of terms. We're going to go into more detail with the next couple of slides. A contracture is the lack of a joint being able to move. It means that when somebody's arm is stuck in a position, okay, it's fixed into position, it cannot be moved. Atrophy is when the muscle wastes away and the muscle is decreased in size. And orthostatic hypotension is when the blood pressure drops and normally low when the person stands up. So we have to make sure we change their position slowly if we start moving them after bed rest. Okay, that's why we always teach you when you stand somebody up, you ask them, hello, how do you feel? Are you okay? You don't stand them up and just start moving them. All right, next slide. The musculoskeletal system complications that can happen from bed rest. The first one is what we're going to talk about is atrophy. The muscles become weak after being unused and they cause the muscles to shrink and become useless. The muscles start to shrink and waste away. How do we prevent that? Performing the exercises planned for the patient. If they're not exercising, we need to exercise to preserve the muscle that they have, and this way we don't have that atrophy or wasting away happen. Another one that happens is contractures can develop. So movement becomes impossible. The joints become stiff when they are not moved. So they get really stiff, and tissues around the joints also become stiff. Soon the joint does not move. It is stuck in a position. So the person's unable to move their hands and exercise their wrists and their fingers. You need to do it. Otherwise, their hand can curl and be stuck in a position, calling it a contracture. You could do your range of motion exercises for them, which Betty Jo will show you. Use correct positioning techniques. Keep them aligned. Use splints or braces or other devices to maintain the proper joint position and keep them in good alignment. Okay, another problem that we get is osteoporosis. It's caused by the non-use of the bones. When legs do not bear weight, calcium begins to leave the bones and enter the bloodstream. So the bones become porous or weak, and this can cause brittle bones, and the person can develop fractures very easily. We talked about osteoporosis in chapter 33. How do you prevent it? Encourage the residents to stand and bear weight if they're able to. If they're not able to, we might have to do some weightlifting or get therapy involved to see what they can do to get some strengthening going so those bones do not start to become porous and brittle. Here is a picture of atrophy so you understand. Again, on the left side is a normal muscle, and on the right side is an atrophied muscle. Do you see how small and skinny it is? Like they're wasting away. The muscle on the right, the atrophy muscle, is almost as small as the bones and narrow. It's not beefy and thick like the one on the left. Here's a picture of a contracture. What happens with a contracture? The arm and the muscles become stiff and then they do not open back up. So this person is just curling downward. You can see how their wrist is bent down and it does not straighten up any longer. The only way you're going to be able to straighten is if you straighten it and then maybe put it into a brace. Okay? So when our person starts doing that, we want to make sure we start opening that arm and exercising it for them so they don't get bent back like that. This was a contracture of the wrist, and it looks like maybe the fourth and fifth finger are contracted as well.